Hi friends, I had a patient who came to me saying that, doctor, I don't want a surgery for the knee. Do anything without a surgery. Well, yes, nobody wants a surgery, neither a patient nor a doctor. Myself, Dr. Ameya Velingker from the Joint Replacement Center and the Sports Injury Center, Bone and Joint Care, Goa. I would like to break down surgery or not a surgery. How will you go about it? In my practice, I had a 42 years old guy who came to me with a very old sports injury. He had gone for a surgery. He had done some ligament reconstruction. He had a cartilage repair procedure done. And for the last almost 2 years, his life is away from the sports onto a walking, and he's struggling with his life. Well, we did an arthroscopy for him and we found that there is a complete loss of cartilage. He's struggling with his life at the age of 42. Well, the only option is remove the remaining cartilage, give a particular form to the bone, and put a glue that is called as a bone cement and stick an artificial prosthesis. And believe me, he was out. He was out without an aid. He's walking normal and he started doing most of the activities which he was longing for the last 2 years. Friends, this is a guy who needed a knee replacement. Let me come back to another example. A 52 years old lady was told to go for a knee replacement because he had a very stiff knee. Now the only issue with this was she had not done a complete conservative management. What we did was, I did an arthroscopy. She had a lot of adhesions in the knee because of the old sports injuries. We broke all the adhesions. We cleared off the joint. We did meniscus repairs. Some of the meniscus had to be debrided. Post-surgery, after 3 weeks, we gave her a growth factor, which is the new PRP growth factor. Viscosupplementation injection was given later. And believe me, even at the age of 52, much older to the previous patient of mine, she did very well with conservative management. So friends, it's not the age, it is the disease. It is how good you have done your physical therapy, or we call it physiotherapy. We can also call it yoga. How well you have taken your medications, the newer viscosupplementations, the newer growth factors, all these things. You need to try all these things as a non-surgical method. Sometimes a partial surgical method, something like an arthroscopic repairs, some cartilage reconstruction procedures like mosaic-plasty or osteochondral transports, which are now new in orthopedic field. And all these things you should first try. If nothing works, there is no age which is a bar. Knee replacement surgery is one of the most fantastic surgery, giving a very good results which will last for the next 15 to 20 years of the life. I prefer knee replacement above the age of probably 60. I prefer above 70. But in rare situations wherein there is a global loss of cartilage over the bone, there is no age bar. You have to do a replacement surgery at any age. So, friends, if any of your friends or you yourself is suffering from a persistent pain in the knee, deformity, instability of the joint, and have tried multiple methods to treat, it's time for you to visit our Joint Replacement Center at Bone and Joint Care. And we will be taking some nice X-rays, MRI, CT to evaluate whether you are a candidate for a conservative management, arthroscopy, or joint replacement. Yeah. Either way, we see to it that at Bone and Joint Care, our main motto is motion is life at any age. Thanks.